Stroke Recovery at Risk Report. An executive summary. We asked you how the COVID-19 pandemic affected you. We asked people affected by stroke to share their experiences. Almost 2,000 stroke survivors and their carers answered our survey. We summarised our findings using 5 headings. 1. National stroke priorities. Delays to national progress. The pandemic has disrupted health and care services. National stroke plans in the UK have been paused or slowed. This puts progress made in stroke care at risk. 2. Treatment. Delays accessing stroke treatment. 30% of those who had a stroke during the pandemic delayed seeking emergency medical attention. In England and Wales, stroke deaths in private homes were 52% higher than usual. Treating strokes in hospital during the pandemic. 76% of stroke survivors who had a stroke this year felt satisfied with the care they received in hospital. 20% of stroke physicians reported that there had been no impact on stroke unit care in April. Being discharged from hospital during the pandemic. 69% of stroke survivors who had a stroke during the pandemic were satisfied with their discharge from hospital. 21% of stroke survivors were dissatisfied with their discharge from hospital. 38% felt they had not received enough support from health and care services since leaving hospital. 3. Rehabilitation. Problems accessing rehabilitation and support. 39% of stroke survivors who had a stroke this year said they had not received enough rehabilitation. 34% of stroke survivors who had their stroke before or during 2019 felt their services were worse than before the pandemic. Problems accessing rehabilitation and support. Around half of stroke survivors had therapy appointments or home care visits cancelled or postponed. 56% have not felt safe to go to planned appointments. Using virtual rehab and healthcare. 45% of stroke survivors had healthcare appointments online or over the phone. 28% of stroke survivors had therapy online or over the phone. However, many have gone without their usual rehabilitation and support. Using virtual rehab and healthcare. 52% of stroke survivors were happy to use telehealth services. 17% of stroke survivors reported online or phone appointments would not work for them. Some reported challenges around communication. 4. Life after stroke. Mental health and well-being. 69% of stroke survivors have felt more anxious and depressed. 68% reported feeling more worried about their health. 69% felt more worried about the future. Caring during lockdown. 77% of carers have been providing more care. Over half of carers feel overwhelmed and unable to cope. Carers supporting someone who had a stroke this year were at a higher risk of feeling unable to cope. Daily living and finances during the pandemic. 41% of people affected by stroke worried more about their finances and employment. The Stroke Association has provided more hardship grants than usual. Staying safe during lockdown. 20% of stroke survivors were advised to shield. 37% of stroke survivors followed shielding guidance by choice. Staying safe during lockdown. 40% of stroke survivors did not shield. Stroke survivors reported confusion over whether they were more at risk. This confusion increased anxiety. 5. Stroke research. Stroke research impact due to COVID-19. The majority of stroke research stopped completely. 3 out of 4 Stroke Association funded researchers had to pause research. Stroke research impact due to COVID-19. Stroke research is underfunded. COVID-19 threatens research funding needed to drive improvements in stroke care and treatment. Our recommendations. 1. All UK governments should urgently progress or commit to national stroke plans and deliver promises made before the pandemic. 2. All stroke rehabilitation should meet national clinical guidelines. 3. Stroke teams should follow up with all stroke survivors who had a stroke this year to review and address their recovery needs. 4. Health and care systems should review all changes to the stroke pathway in response to COVID-19. Stroke survivors and professionals should be involved in this review. 5. Health and care systems should urgently increase access to mental health services for stroke survivors. 6. Governments and local authorities should provide more support to carers. 7. When restarted, stroke research should be made a priority. 8. UK government should continue or commit to investment in act fast public health messaging.